Ladies and gentlemen, thank you very much, Peter Ndoro. I would like to thank all of you for taking out time and coming to listen to us, putting our case before you. It is a great pleasure to discuss with you this important issue of early childhood development. Maybe from the onset, we need to say that ECD is a double dividend. It is a double dividend to the future of our children, but secondly, it's important for securing the future of our country. And it is important to catch our children at a very young age. And if we think we are going to start taking care of children at the age of 12, we would have missed the boat. And two other things that I like about ECD is the liberation of women. You have other things to do, or even if you don't look for work, you just have time to look at yourself, because women don't have time to look into themselves, and they do need time to do that. One other thing is that it creates better space for families to be trained in parenting. And parenting is not only the responsibility of women, it is also a responsibility of men. I would also like to take us back to the priorities of the present administration, which is education, health, fighting crime and corruption, rural development, and others. But what is at the apex of those priorities is education. So that is why, as social development, we deemed it fit to prioritize early childhood development. Children have a right to receive education as it is expressed in our Constitution and international instruments such as the African Charter on the Rights and Welfare of the Child and the UN Convention on the Rights of the Child. South African children cannot be denied the benefits of this fundamental right. ECD is also important because it develops children cognitively, psychologically, emotionally, and spiritually and otherwise. And its provision must be considered part of the fundamental rights. Early childhood development has been recognized as the most powerful tool of breaking the intergenerational cycle of poverty and in making a real and lasting difference in the lives of children and their families. Recent research, including the report of the South African Child Gauge 2013 reaffirms the significance of ECD in determining future health, behavior, and learning outcomes. Research also confirms that the first 1,000 days of the child are very important. And when we talk about the first 1,000 days, we talk about the child from conception. How a mother should look after herself with the assistance of the partner. The National Development Plan Vision 2030 identifies education as one of the central pillars of South Africa's long-term development. Furthermore, the NDP views ECD as critical for ensuring that children are able to reach their full potential. But we should also congratulate the ruling party, the African National Congress, for taking a decision in its Mangaung conference that early childhood development must be made a public good. And furthermore, the conference decided that it is not only the first 1,000 days of the child that are important. We should move on and look at the child from a pregnancy up until the age of 4. The aim of the Adopt an ECD initiative is the brainchild of the NDA to take forward ECD as a public good as pronounced in the conference of the ruling party. Given this imperative, what is the strategic and competitive advantage of business, government, civil society organizations in working together when it comes to investing in early start of our children? The bottom line is that improving the lives of children is a shared national responsibility. As we work towards the celebration of 20 years of freedom, we identified ECD as the most immediate priority. Our records show that we have made significant strides. For example, by the end of 2012, more than 984,000 children were accessing ECD services. We've also increased the number of children that are directly subsidized by more than 100%, from 230,000 children in 1995 to more than 545,000 children to date. One of the key achievements in this regard was the equalization of ECD subsidy for children across all provinces to 15 rands per child per day. And what we tried to push was that it's not only children from urban areas who have rights, because the subsidy was not the same. Children in the urban areas would be given more than those from the rural areas. And so I'm glad to announce that at least most of the provinces have started or are implementing that pronouncement. But also it is important to also note that government has put more budget for early childhood development. Starting from this financial year, for over a period of 3 years, we have 1.2 billion, and the bulk of that 1.2 billion goes to ECD. I think it's 800 million. And then the remaining amount goes to victim empowerment, as well as child-headed households and youth-headed households. Recently, MINMEC also approved the proposal to increase the number of days children spend at an ECD center from 165 days to 260 days per year. The number of registered ECD facilities has grown from 4,612 in 2004-2005 financial year to over 21,000 this year. We are currently conducting an audit of ECD centers to obtain information on the nature and extent of early childhood development, provisioning, services, resources, and infrastructure. And all the time when we say we are auditing ECDs, women run away, because I must also say that people who have been keeping this going are women. They've taken their time to volunteer. And I'm afraid, Peter, all the time when there are soft jobs that need people to volunteer, it's women who take up those jobs. And when the issue of stipends or government taking over, people talk about skills. And when they talk about skills, they leave out the on-the-job training that women have through their volunteer programs. So, working together with the Department of Higher Education and Basic Education, we are going to look into how we upgrade or have courses to ensure that we have strong practitioners in ECD centers. Because we all know in countries where ECD has been successful, you have graduates. But I think we have women who have put their precious time and energy with 500 rands or 200 rands a month and have been looking after our children. And those women must be empowered to continue with the job whilst we are looking at the ones that are sophisticated, because it is true the development of a child needs a highly qualified person. Because you have different kinds of children, you have children with disabilities. And we need to be able to assist families of children with disabilities from birth. Because a disability is a challenge. And so if we don't have space to empower those families, we would not have done justice, because equality should not be for those that think they don't have a disability. Essentially, the Adopt an ECD initiative is a starting point for a joint national action to improve universal access to ECD services. This campaign sets an important agenda for the transformation of ECD in South Africa through private-public partnerships. The key issues that were identified in the 2012 National Conference of ECDs came up with new or identify some policy issues that have to come up in the sector. And those include the new comprehensive ECD funding model, amendment of the Children's Act, improvement of the ECD workforce development, implementation of the minimum national norms and standards, as well as modernization of ECD structures. And I must say that when we all talk about minimum standards, also people think that we want to close ECD centers. And because we have pronounced that ECD is important, what we are trying to do during the process of audit, when there are ECD centers that we think don't meet the standards, we assist them with the bare minimum standards and also try and ensure that they register partially and work with them in improving their conditions. And NDA is going to be very important in ensuring that we empower ECD practitioners as well as communities, because communities must also be involved in early childhood development, because early childhood development is not about the four walls. There is also non-center based early childhood development. Working together with NDA, we've also introduced mobile ECDs, because we can't wait up until we have four walls. Far there in Babanango, Omqanduli, we have to reach the children as soon as possible so that we can make an impact. By the end of this financial year, we aim to finalize a national ECD policy. I must say that other people are saying to themselves, "Ow, but we are paying tax. What is the government doing?" We also have an IMC that is looking into early childhood development. It is composed of social development, health, basic education, higher education, justice, the police, and public works, and local government, because local government has the responsibility of infrastructure. Social development has just the responsibility of driving programs. But I must also say that there are already baskets of services that government is providing to children, but they are not always taken as a basket of services. The grant, 15 rand per child per day, free healthcare services, food at school. The police also have our programs that deal with the issues of violence against women and children, as well as justice. And I must say that also having a well-organized ECD is going to assist us to fight the scourge of violence against our children, because we'll be able to monitor them. And I'm sure we are all interested in that, because there is a saying in an African saying or idiom, I quote, that says, "It takes a village to raise a child." I must also quote Ubaba Mandela, the first president of the democratic South Africa, who said, "There can be no keener revelation of a society's soul, the way in which than the way in which it treats its children. So I think this is a good cause, and we cannot be able to contextualize the amount of money that we need for this program. But what is important is the outcome of years to come that will make South Africa a better country. I thank you.
Thank you very much, Minister. Ask you to take a seat there. Thank you so much.